There are certain cultures that practice things that are very detrimental to our health and well-being.
Mother and child health usually occupy a prime place where issue of infant mortality is being discussed. Maternal and child care is a critical aspect of health care. In many parts of the world, traditional birth attendant practices and modern maternal practices coexist. But what are the key challenges facing expectant mothers, and what can be done to improve care? In many cultures, traditional birth practices have been passed down through generations. While traditional practices are known to be beneficial, some can be harmful. These, therefore, necessitate the need for a balance between modern maternal care and inherited practices. There is hardly any doubt that modern medicine has made significant strides in improving maternal and child care. Skilled healthcare providers with advanced medical technologies help save lives.
In relation to maternal health, especially in pregnant women, hypertension is still predominant because many people are brought into the hospital after they've had one seizure or the other. That's what we call eclampsia, or they are pre-eclamptic, very high blood pressure in pregnancy, and pregnancy and hypertension cannot stay. Either the pregnancy will go away or the mother will not survive.
Those in urban centers and those with economic power have better access to modern healthcare. However, the same cannot be said of many remote areas of the world. This therefore calls for policymakers to look beyond the cities and prioritize siting of medical facilities in most underdeveloped areas in order to make healthcare accessible to the poor.
There are certain people who do not like to deliver their women do not like to go to hospitals to deliver their babies. They have older women in the family who have done this for so many years. Their mothers have delivered 11, 12 through the same person. So people would prefer traditional birth associates. And so usually I think at that point in time, what we could do is go to these communities where this is very predominant and then speak to be able to train, educate these women and also educate the traditional betters. That way they are in better abilities to be able to take care of these women. These traditional betters can also do antenatal care if they are trained properly.
These challenges can have devastating consequences, including maternal and child mortality.
I will first of all ensure that our modern facilities are equipped and increase the level of our labor so that we can have a very good number of laborers who can go about assisting our health practitioners.
I advise that mothers should seek for medical care from recognized and trained personnel as well as facilities, like I said. In fact, over the years now, people feel labor is painful and that's why they like taking those herbs. But it will interest you all to know that in medical practice now, we have labor analgesia that are given to mothers. They deliver baby devoid of pains. So nobody should be afraid of coming to the hospital because they feel, oh, if I don't take these drugs, my labor will be prolonged, I will go through excruciating pain. So labor are made easier in the hospital than when it is done at home.
While traditional birth practices may not be totally ruled out, pregnant women are advised to take preventive care by utilizing the antenatal and postnatal care provided by the modern birth practices. So by bridging the gap between traditional and modern practices, we can create a brighter future for healthcare.
Some people will do antenatal. Once they are done, they think that it's over. 6 weeks after you deliver your baby is still called pregnancy period because it's also vital times. People have eclampsia, which is seizure. Women die during that 6 weeks. And it's also going to be classified as women survivor. It's going to be classified as maternal mortality.
Yeah.
So I think everyone who has the ability or everyone should have the opportunity to have antenatal care before birth and also have postnatal care. This increases the chance for women and baby survival.
Close to 300,000 women die every year during childbirth because of pregnancy.
Wow.
And over 2 million children die during their first month of being born. And that same amount of children also they die in the womb before they are born, stillbirth. So put together, that's one preventable death in 7 seconds.
By working together, we can create a world where every mother and child has access to quality care and support.